One morning I got up and my husband was sitting next to me and I just nudged him on the arm and I was like, look at his eyes. His eyes were white. The whites of his eyes were actually white. And we hadn't seen that in years.
A mother was watching her son's eyes every morning for a sign that no test at the time could tell her. Sickle cell disease has been in the medical textbooks for more than 100 years. It disproportionately affects Black Americans and Hispanic Americans, people who share ancestry with the African diaspora. For most of that history, doctors could manage the pain, but they couldn't change the disease. That changed when the FDA approved a new gene editing therapy, first for patients 12 and older, and this July for children as young as 2. Dr. Lametra Scott is a pharmacist. She's also the mother of Rickey, one of the first commercial patients to receive treatment at the TriStar Centennial Children's Hospital in Nashville, Tennessee. Dr. Haydar Frangoul leads the program that treated him.
And I'll never forget this. So my baby was born in September. I get a phone call the day before Thanksgiving. So this is in November now. So I get a phone call the day before Thanksgiving and she says, "Oh, I've got great news. Rickey doesn't have sickle cell disease. He only has sickle cell trait, just like you and your husband. So everything is fine." At this moment, I'm excited because we didn't tell anybody in our family that this was a possibility because we didn't want to prematurely worry people. We didn't even know. So we waited. And I'm excited. I'm like, oh, thank you, Jesus. My baby doesn't have sickle cell disease. And we're moving along our happy way. I get a phone call from the health department. She's a caseworker. And this is probably a little bit later, maybe about the 12-week time frame at this point in time. I get a phone call. And she's saying, "We need you to bring your child in for confirmation screening." And I was like, why? And at this point, I'm like, people at the health department, there's too many people, too many irons in the fire. We've already done this. I took him to his primary care doctor. He's good. And she says, "No, Miss Scott, he's not. Based on the newborn screening that we did, he has sickle cell disease type SS. And we need to bring you in for confirmation screening to get him connected with a hematologist, the whole bit." So, needless to say, it felt like somebody had knocked the wind out of you because at that moment, it's almost as if there was a stopwatch for your child's life just because of the impacts that sickle cell disease has on the person's life and the ability that it has to basically make people die early.
Lametra's stopwatch has a name in medicine.
People with sickle cell disease in 2026 have a life expectancy in the mid to late 40s, which is significantly lower than the general population.
That's Dr. Haydar Frangoul. He directs the Pediatric Hematology, Oncology, and Stem Cell Transplant program at TriStar Centennial Children's Hospital, the doctor who treated Rickey.
And the reason why is because it affects every single organ in the body. It affects the brain, it affects the lung, the heart, the kidneys, the bones, and it affects overall health. So individuals with sickle cell disease actually continue to suffer from these complications throughout their life, and it is cumulative. The older they become, the more complications they have. Having said that, in now probably close to 30 plus years ago, we discovered there is something called bone marrow transplantation, which is a transplant of the bone marrow cells from a family member, a brother or a sister that are not affected, can potentially cure this disease. But unfortunately, 80% of people today with sickle cell disease in the United States do not have a brother or a sister that's a match to them. So that leaves 80% of the people with sickle cell disease with no curative option. So what we did in the first patient in the world was treated in our hospital. Her name is Victoria Gray, and she is very famous. She gives talks all over the place. I'm not violating HIPAA because she tells her story all the time. And she came to us because she wanted a very, very high-risk transplant from her half-brother. And she got scared about the complications because when you don't have a full match, there's a lot of complications. So we were running this trial here, and she was the first patient in the whole world to receive this treatment. And this treatment, in basic words, is we take the stem cells out, we collect the stem cells from the blood of individuals with sickle cell disease, gene edit them using this CRISPR technology, telling the cells to make high levels of fetal hemoglobin and put them back into the patient. Now, when we put them back in the person receiving them, we give them 4 days of chemotherapy to kill their cells that are making sickle. And those new cells start making high levels of fetal hemoglobin, more than 40%. So the individuals with sickle cell disease become basically a trait with fetal hemoglobin. And what we have seen when we did these trials since 2019 is that individuals who receive this, the symptoms related to sickle cell disease totally go away. For example, Victoria Gray, again, as an example, prior to receiving this therapy, she was hospitalized 7 or 8 times per year. And now she doesn't have any hospitalizations. She's never been hospitalized. She's taking care of her kids and enjoying life as somebody without the disease. So I think it's transformative in a sense that it allows every individual with sickle cell disease to have a potential curative option for their disease.
That science felt a long way off when Rickey was 3 years old, fighting for his life in a different way. Well, there was mention of a blood transfusion after an acute chest syndrome
Acute chest syndrome.
when Rickey was 3. Can you walk me through that moment? What were you told and how did it change how you managed his care afterwards?
Well, when babies or kids have sickle cell disease, it's oftentimes understood that if your baby has a fever, you take the baby to the hospital immediately because it's an emergency. And that's oftentimes because a fever may be the only sign that there is an infection brewing under the surface. Well, in his case, he had a fever, but that was it. Nothing else was wrong. He didn't have cough. He wasn't fidgety. He wasn't complaining about pain. And most times, if a person sees that their baby has a fever, it's like, oh, I'll just give them some Tylenol or some ibuprofen and let it go. Well, in sickle cell disease, I knew that that was not the correct option to undergo, and it's basically because people who have sickle cell disease, they have a compromised immune system, and babies and children pretty much acute chest syndrome is the leading cause of death before the age of 5. So that's all the more reason why if a fever starts, you need to take them in immediately. So I took him into the hospital and they asked me what were the symptoms that he was having. And I was like, well, he only has a fever. That was it. That's the only reason why he's here is because he has a fever and this is the protocol. Well, because of that fever, they just decided, let's just do a chest x-ray just to see how things are going. And from that chest x-ray, you could see that he had infiltrates in his lungs. And that was a sign of acute chest syndrome. So with acute chest syndrome, that actually is when you have sickle cells that form in the lungs and they are able to reduce the amount of oxygen that happens. And in his case, his hemoglobin levels began to drop beyond what their baseline levels were. And that is what triggered the need to have a blood transfusion.
I'm going to move forward and ask, this is something that people probably don't even think about it, or families that, they don't think about the fact that sickle cell affects your daily choices, like hydration, activity, school accommodations. What did an average week look like for you and Rickey before this treatment that you got?
Oh, an average week before gene therapy, it could every 3 weeks we would end up going in for blood exchange because that was basically how he was able to maintain his sickle cell disease or maintain its treatment before he was able to receive gene therapy. He had to switch from the oral medication that he was taking, so he would do his exchanges every 3 weeks. On a day-to-day basis, it consisted of he's a kid, so he goes to school. So he goes to school, but unfortunately, because of the type of medication that he had to take for pain management, which is an opioid, and they're not able to keep that at the school. If at any given time he begins to have a pain episode or a pain crisis while he's at school, then I would have to leave, go to the school, take him medication, and then, come back home and hope that it holds him over during the time that he's there. As far as what he does as far as physical activity goes, he likes to play basketball. He was into playing baseball. But last year, when he got a central line place, he had to stop all those things because he couldn't play physical contact sports because of the risk of what could happen to the line. And I can tell you as a mom, even though he was not participating in sports at the time, the fact that he was at school with a line, I was on pins and needles almost every day because they're kids. You never know what may happen. And when he went back to school with the line, I remember he called me one day because somebody bumped him
Watch
in
out,
the
excuse
line.
me.
And he was like, I don't know if this is going to hurt me. I see blood in the line. I was like, well, hold on. It was normal. There was nothing outside of the norm, but it wasn't that, somebody deliberately did something. They're just kids. Somebody's walking in the line and they just bump shoulders. But again, that's a worry that I always carried with me. And thank God nothing happened, but that didn't mean that, that was the norm of, of what to expect, because it very well could have.
That was daily life for years, but underneath it, Lametra was already watching the science.
And as we waited a little bit longer, what I began to notice was that my son began to have more pain crises, more pain episodes, more missed days from school. And I knew what the future entailed if we didn't do something. I knew that organ damage was imminent. I knew that the risk of him having a stroke was, as it didn't reduce over the years. It was actually, just compounding. I knew that um, sickle cell disease would begin to impact his life more and more because it doesn't get better as people get older. It just compounds and gets worse. So that's when I turned back to gene therapy, because at this time it was now approved for people that were less than 12. And at this point, he's now 13. And I wanted to reach out to find out exactly what it entailed. How could my child be positioned to receive this gene therapy? So that's when I sought out a conversation with Dr. Frangoul, who was very open to have the discussion to see if this would even be something that could work for us.
What was it like being one of the first families to go through this at the medical center? I mean,
Well,
this must have been
what?
really, really
I
stressful
didn't
too.
know. I did not know that we were the first. I found that out while we were in the hospital. What I knew was that TriStar had done this process and done gene therapy on other people. I just didn't know that those people were a part of the clinical trial. So one day they were doing rounds, and one of the doctors says to me, she says, Rickey is our first commercial patient to do gene therapy. And I was like, he is? No idea. But all in all, had I known that before, it would not have changed my decision to go through with it, because I knew how my child was suffering. I knew how I wanted something different for him. And as a mom, you will, go to the ends of the earth if that's what it took to mean that your baby would be okay.
What was I guess, how did he take to it? What was that like? Was it every day kind of a touch and go? What was he experiencing during that period?
During the hospital stay, initially things were really normal. Like, he was doing the normal things that he would do if he were at home, like playing on his video games, watching YouTube, and the things that most kids would do. That was during the first week. It was kind of boring. But that was also during the time where he started doing his chemo. And the effects of chemo are not always immediate. Typically, the impacts from chemo kick in 7 to 10 days later. And just like clockwork, they did. So it started with him about a week or so later after doing his chemo. He began to get very, very nauseous. And from the nausea, I would say he began to get a little bit more fatigued. And then from the fatigue, the mouth sores began to develop. And we anticipated it as far as what the term is. And that's where you have the whole gastrointestinal system is just, they can have sores from your mouth to your throat to your stomach, the whole from end to end. Basically, the whole GI system can be impacted. And for him, the mucositis was pretty bad. He got to the point where he couldn't eat, he couldn't talk, he couldn't do anything. And we had to end up doing parenteral nutrition, where he was able to get nutrition that he needed through the central line that he had. And all during that while, even though he couldn't eat or drink or talk, he had a whiteboard. And that is how we communicated in terms of what was going on and if he needed something. And he was able to advocate for himself as it relates to, how his pain was being managed during this time. And he wrote a note to the hospital team that kind of implied that he needed people to listen to him, listen to what he was saying as it relates to whatever he was being prescribed for pain. It was not working. And he felt like his needs were not being addressed initially. But that was only a one-time ordeal, because with managing pain, there's a fine line that you have to walk between prescribing too much narcotic medication and causing an overdose and respiratory failure and people dying. And then you have adequate pain management. I think that I would see him at times just staring in the mirror, and I would ask him, I was like, what's going on? He's like, my hair, it's all gone. Or at times when I think he began to experience, like, his blood counts began to decrease, which was expected as far as gene therapy goes. And with that, there's risk for infection because you don't have an immune system anymore, because your white cells are all gone. There's a need for transfusions of red blood cells and platelets because, again, they're all gone. And when your platelets are really low, it's very easy to bleed. And I will say that is one of the times that really scared him, because in his mouth you could see it was just all red, because his gums were bleeding. And it was one of those bleeds, like, it's not something that pretty much that just goes away. He thought that by, like, dabbing it or trying to get it off, that would help, but actually, because his blood is not clotting, it just bleeds even more.
Hey, before we get back to the conversation, if you're new here, The Color Between the Lines has a growing library of educator guides and discussion resources at my Etsy shop called The Color Between the Lines Market. It's in the links below. And if the stories like this matter to you, please hit subscribe so you don't miss the next one. And it really helps me continue my work and grow this channel. Thanks so much. Now let's get back to the conversation.
And I'll tell you that even though every day after transplant, it was a numbers game. We were always watching the numbers to see exactly where they would go. But for me, I didn't need the numbers to confirm what I already knew. And I knew this because if you know people with sickle cell disease, oftentimes when you look at them, their eyes are yellow or a yellow beige tinted. And that's because of the rapid red blood cell breakdown. And when it breaks down, it causes bilirubin to be released into the bloodstream. Well, bilirubin normally is excreted through waste, but because these cells are breaking down so fast, the body can't get rid of it. That causes the bilirubin to accumulate in the whites of the eyes, and it causes the whites of the eyes to turn yellow. My son has had these tinted colored eyes pretty much his entire life. And that's pretty much also how I knew if a sickle cell crisis was about to come on, or if he was in some type of pain or distress. We could tell by the whites of his eyes and if they were beginning to take on this yellowish color. One morning I got up and my husband was sitting next to me, and I just nudged him on the arm and I was like, look at his eyes. His eyes were white. The whites of his eyes were actually white. And we hadn't seen that in years. So for me, that was the first sign that I knew that the cells that he had, they were stable. They weren't breaking down like they used to. So while we were waiting for all the numbers to come back to confirm that the process had worked, I knew in my heart of hearts that it was already done. He likes to tell people that because he's not to the end yet, he's still on the journey, but he can tell that he feels better than he had before. He doesn't wake up and immediately need pain medicine every day before his feet hit the floor. that is where we are now in regards to just recognizing the impact that sickle cell disease doesn't have anymore. And I think he's in this exploratory phase in discovering who he is outside of sickle cell disease. And oftentimes people carry this sense of unknowing in terms of it's a new life and it's kind of scary because all they have known is sickle cell disease and I can't do this, that, or the third because I have to worry about sickle cell disease. And when you ask them, like, who are you and what do you want to do? I don't know yet because I've never been able to have this experience. But I think he's open-minded to it. He's eager to find out like what's next, what can he do? Um, so yeah, I think he's at the space now where he is wanting to tell his own story. And I'm so happy that he is embracing what he has done to be able to help others to come behind him.
For now, it appears Rickey's story is ending in success, but Dr. Frangoul says thousands of other families are still waiting on something else entirely.
I think so. These therapies are expensive. Private insurance companies are uniformly paying for this therapy. The federal government came to actually gave the option to every state in the United States to do this therapy, and for the federal government to help defray some of the costs associated with this therapy to the states. Believe it or not, the majority of the states signed up, but the one state that we are having a lot of trouble with that decided they are not going to offer this to their residents is Alabama, which has extremely high numbers of individuals with sickle cell disease. In fact, I have several doctors calling me from there wanting to refer patients, and those patients are suffering. And guess what? Alabama decided that they should not offer that to their people with sickle cell disease. So the more you and others talk about this, I hope that the legislatures, the families and advocacy groups will really speak up to make sure this therapy is available to everybody. Because think about it, although the therapy is expensive, it's a one-time treatment. If I take an individual with sickle cell disease from the time they are born till their mid-30s and 40s, the cost of caring for somebody like this significantly outweighs the one-time cost you are paying to get some of these genetic therapies.
Well, it sounds so exciting and it sounds so very hopeful for many, many families. And I appreciate you even sharing this today. And I hope that others who listen to it will get a lot of benefit and be able to pass it along to whoever needs it.
I'm really hopeful. I think I've been doing this for 30 plus years. And now several years back, even before we got the approval, because I was looking at the results of the clinical trial, and what I kept telling my patients and the people that call me, I say hope is on the way. And now we are there, correct? I think we are there now, that individuals that have sickle cell disease have hope and have a better option that they can use to get rid of this awful disease.
But hope isn't the same as easy. Lametra wants other parents to hear that too. What would you say to a parent who has a child with sickle cell and they're listening to this, wondering if this is the right path for them? What would you want them to know?
I would want them to know that it's not an instant fix. The process is long. It does require resources in time and finances and family support. Those are three things that you will have to have solidified before you can even begin down the pathway of wanting to do gene therapy or any curative therapy. Because again, it's not a one and done. It's not an instant fix. It will take some time, and there are things and tests and doctor's appointments and visits that will be required in the interim period, and you have to be able to navigate and be nimble and flexible to make sure that all those things happen. Because if anything gets out of sorts, then that could throw off your end game as it relates to being able to achieve the cure and go through the gene therapy for sickle cell disease.
but I am appreciating all this because it does give people at least hope.
Yes, it definitely gave me hope. And for people that are listening, don't be afraid to seek out information. If where you are in the system that in the health system that you're with, if they don't have access to the information or they don't know who to connect you with, don't stop there. The internet is widely available for everybody to seek that information. So you have to have some, gusto within you to keep pushing forward when if you find that you run into roadblocks.
Thank you so much, Dr. Lametra Scott and Dr. Haydar Frangoul, for trusting me with this story. This is so important to so many lives. If you want to learn more about gene therapy for sickle cell disease or connect with Dr. Frangoul's program, the links are in the show notes. I'm Esther Dillard, and this is The Color Between the Lines.